We've all had a prescription, whether it's a 2-week course of antibiotics or 2 years on beta blockers. But how do they work? Well, as it stands, at least in Australia, you go in to see your doctor, they tell you what is wrong with you, and then they will give you a prescription. From that point on, you're pretty much on your own. Well, does this work? Well, the answer would be kinda. For many patients, it's not just about forgetting to take the pill, but it's also about the lack of guidance. In 2005, research showed that 40% of prescriptions failed due to a lack of adherence. More recent studies indicate this number has risen to 50%. Current ways of solving this problem is by using little gadget reminders, but that doesn't seem to be working. So, why is this such an issue? Well, over 66% of adults need long-term prescriptions, but many don't stick to them, risking serious health problems. But let's take a look at it from an ethical point of view. Well, when examined from a perspective of a utilitarian ethical framework, the good outcome must outweigh the bad input. Though you might not like your medication, completing it will benefit both yourself and others to a degree that holds more weight than your initial dislike of the medication. While taking medication can be unpleasant, completing the full course gives you a better chance of recovery. Taking your meds on time ensure they work effectively, leading to better long-term health and preventing future complications. More importantly, with antibiotics or similar medications, not completing the course can lead to development of superbugs, which can spread to others and cause greater harm. Well, why should I care if I help others? According to Kant, a famous philosopher, he says, admit no exception in the favor of inclination, and that implies that perfect duties must always be adhered to. But what is perfect duty? One of these perfect duties is the responsibility to prevent harm to others, and by not following your treatment, you're not only harming yourself, but also everyone else, the healthcare system, and contributing to the rise of superbugs with antibiotics.
So it's established. Adhering and completing your professionally prescribed medication course can be strongly argued as ethically good. But how can we improve on the existing system and make it ethically better? Well, what does the literature say that would help adherence? Well, the literature says that tracking a patient's dosage and frequency of consumption is a good start. Now, hold on. Tracking a patient, is that ethical? Well, according to the Mental Health and Wellbeing Act of 2022, tracking a patient for no reason is unethical. But if the information can be used by accredited medical professionals to help in the treatment of the patient, then it's ethically justified, according to the law. Well, how does our system work? Well, we envision this for a future case scenario. A patient goes in to see their doctor and is given a prescription. At this point, the patient is informed of the system by the doctor and can either choose to stay in the system or opt out, effectively giving their consent. When the patient goes to the chemist to receive their prescription, the pill bottle will contain an NFC chip, a battery, and a simple sensor. Every time the patient takes a pill from the pill bottle, the sensor is able to detect this and record it. When the patient completes their prescription, or goes to get a refill, and returns the pill bottle either to the doctor or the chemist, the doctor or chemist are able to retrieve the data gathered from the NFC chip and present it. It is important to understand that this NFC chip is encoded, and the only people who can access it are the chemist or the doctor with the appropriate codes and keys. So, how is our system ethically better than what currently exists? Well, as established, by being able to track the patient, we are able to better ensure adherence long term by building strategies between the doctor and the patient. Our system complies with all the laws, especially those set up by the Health and Wellbeing Act of 2022 regarding both privacy of information, consent, and the tracking of information and the handling of medical information. From a utilitarian standpoint, our system allows a doctor to better address the problems a patient might encounter when adhering to a prescription, and better allows a patient to adhere in the long run, therefore having a net positive on everyone involved regarding adherence and medication.